So I'm here with co-chair of the 2022 AES Scientific Meeting. It's our 67th annual WIT. And you and Sarah Kellogg came up with the theme of creating smiles is a serious business. And you have a power-packed 2 days for us. Tell me how you guys came up with that title first before we get into some of these people.
Yeah, our president-elect Keith Kinderconnect really was the one who guided us, Jason, on this, and came up with a great topic, I think, and really looking at an expanded view of what we do in AES and in dentistry, as far as looking at the whole person and our role as oral physicians, which I know we take very seriously in AES, and so we kind of ran with that and tried to see how we could do something that would be, as we always desire, the best seminar that you've ever been to. And so there's been a number of people that we have interacted with over the last several years that have been on the front lines of some very exciting things. And so we tapped those folks and they all agreed to participate, which we were thrilled. And we're going to have some fun. So we're going to talk about the classic subjects of our academy, our society, which is temporomandibular disorders and occlusion. We're going to address things like restorative dentistry and orthodontics and some of those topics, which are very pertinent to what we do. We're going to bring in, though, a subject that we've been discussing for several years now, which is airway and breathing and sleep disorders. And what our goal is to bring in a class, a meeting where all of these things are seen as how they blend together, how they overlap, how they have cause and effect relationships on each other. And so if I can share with you a little bit about the format, I'll just walk through with you and ask me any questions you have. But on Wednesday morning, the first day, we're going to have three outstanding presenters, two of whom are members of our organization that everyone's very familiar with, and a third who is a very well-known name in dentistry. So Mark Piper and Jim McKee and Jeff Rouse are going to do a program for the morning. And first, we're going to have Mark present on what we've learned over the last 40 years. I don't know of anyone that studied temporomandibular disorders and occlusion more in depth than Mark has. Thousands of MRIs, thousands of CBCTs. Mark is putting together for us a presentation that is going to look back historically and walk us through all the important things that we've identified that are critical to our practices. Then I've asked Jeff Rouse and Jim McKee, who have a very friendly banter with each other and a great deal of respect for each other, to talk about sort of the TMD occlusion airway connection. And Jeff has been a strong proponent of airway being a central theme of complex dentistry and what we see in problem solving. Jim, of course, is coming from a very, very strong perspective of a joint-based occlusion. And so I've heard Jeff and Jim present together before at the American Academy of Restorative Dentistry, and it was very provocative, very thought-provoking, and very great information. So I've asked Jeff and Jim to present together on diagnosis and treatment planning relative to TMD occlusion and airway. And then after their presentation, I've asked them to come back for a second presentation and talk about case studies. And they're going to present together important, significant case studies in their work. Jeff's in San Antonio and Jim in Chicago. Then we're going to have a 30-minute panel before lunch with Mark and Jeff and Jim. And we're going to throw out all our hard questions to them. And I know they're up for it, but all three of these clinicians have great integrity and great expertise and are, deeply invested in research. So I think that morning is going to be worth the whole 2-day meeting.
Yeah, that is a great way to start off with 3 people that are not only great clinicians, as you've talked about, and great presenters, but they're also extremely confident and well-spoken and ready to back up what they have to say. So I think their presentations are going to be great to watch, but then that panel discussion could really be entertaining along with informative. So really looking forward to that. That's a great looking morning.
Yeah, I think so. And the thing that is nice is that all of them are very strong in their convictions and their confidence in what they do, but they are also friends. So it should be a friendly banter, but also one that's productive. And that's what we want. That's what we want. Then what we're going to do is continue on that theme of TMD occlusion and airway and the connection between those things that we're seeing. And we've got some wonderful afternoon presenters on Wednesday. The first will be Mark Cruz, who's a restorative dentist from Southern California, member of the American Academy of Restorative Dentistry. And Mark has really focused the last 10 or 12 years of his career on this airway subject, coming from the perspective of a restorative dentist. And the research that he has done and the discoveries that he's uncovered have been really significant. He's a deep thinker and far advanced in his understanding. And so I'm very excited for him to present to us. It really will be about pediatric considerations. So I've asked him to focus in on what do we find from birth that is significant in the developing of the craniofacial complex of dental occlusions. What's the role of airway in all of that? And how does that relate to TM disorders? So he'll do a super great job. And then Brian Shaw, a physician from the Chicago area who now has moved to Florida and is working with Mark Piper, is a terrific maxillofacial surgeon, but also diagnostician. And so I've asked him to do a session on imaging, diagnostic imaging, specifically CBCTs and MRIs, but looking at how can we begin to be more adept at diagnosis as we ourselves look at these images of the joints and of airway, of sinuses, et cetera, and diagnose problems in our patients. So Brian will do a terrific job. I've heard him speak on this before, and I immediately went up to him and said, "Can you please bring this to the Equilibration Society?" And he gladly agreed. Then after our afternoon break, we have a session on orthodontic considerations with one of the top clinicians in the country, Becca Bacow, who's in Seattle. She's an orthodontist, but has a special focus on occlusion and ortho related to airway considerations again, and joint health. And so we want to blend all those things together and listen to the experts on what they're doing in diagnosis, treatment planning. And she's going to show a lot of cases that she's resolved and how she has approached that. And so at the end of those 3 presentations, we're going to do another panel discussion, this time with Mark Cruz and Brian Shaw and Becca Bacow.
That's great. Another one that really gets to all the stuff we love about the AES, the tying into this. I think that especially the pediatric considerations that's become more and more, we're seeing stuff on that. Like did you attend that ADA airway symposium they had?
I did not attend it, but they've had 2 actually now, if not 3, and sold out. Really great information. And so, yes, those are the things that we're going to be talking about, and how we can look at our malocclusions and begin asking why. We've always asked what can we do? How do we solve this? But we really haven't had a lot of answers on why you see many of the severe malocclusions that we observe. And now those answers are starting to come to the forefront and causing us to go back and look at younger and younger and younger patients.
Yeah, so that's going to be great. That night, people won't want to miss the president's reception. They are doing something unique this year since last year was canceled. Dr. Nelson and KinderConnect are going to be doing a joint president's reception this year. So
that's right.
It'll be twice the fun.
That's right. And it should be good. Stan lives, I believe, still in Las Vegas, and Keith in Birmingham, Alabama. So we usually have a theme for our president's reception. I'm not quite sure how you're going to combine those two, but we'll do it. And it'll be a big party. I'm really excited about that. And then on Thursday, as we continue on this theme, which really what we want to do is just focus it on what we are all about in AES. Everything that the attendees and members come for is what we want to focus in on. So starting in the morning on Thursday, we've asked Steve Karstensen, who is a wonderful clinician. Most everyone knows Steve, and he's been involved in many of the outstanding teaching academies around the country. But Steve has written a book in the last year on dental management of airway problems. And he's also had a long history of treating TMJ disorders. And so I thought he would be the perfect person to say, come talk to us about the latest information on oral appliance therapy. What are you using, Steve, and what's being used around the country to manage joint problems, occlusal problems, airway problems in the way of appliance and splint and orthotics. And so he's going to present that to us and really make sure we're all up to speed on what the latest science is on that, and what he's using as well as others around the country. It's very interesting because some of the traditional appliances that we've used, like the Michigan appliance, the typical centric relation appliance, we're now learning, as I hope most people on this discussion know, that some of these appliances, when there's an airway problem, can actually make the airway problem worse. And so we're having to pay attention and do more screening before making appliances on people that are bruxers and people that have TM symptoms and headaches, to make sure that we actually are doing the proper therapy. So Steve is going to really catch us up on that, and I'm excited to hear what he has to say and to learn from him. Then we have two other members that are going to speak to us that are outstanding members, John Cranham and Drew Cobb. John, of course, is the past clinical director of the Dawson Academy, and Drew is a senior faculty at the Dawson Academy. But they've developed a fully digital workflow for both TMD and restorative dentistry. And so I felt that that would be very appropriate and cutting edge for them to bring that information to us. So I've asked them to bring what they are teaching to their students and what they're doing in their practices in Virginia and in Washington, D.C. And I'm sure they'll bring an outstanding program.
That one's going to be really interesting to see how they've digitized the workflow for that combination of things. So yeah, another interesting.
Yeah.
Good.
Yeah. And then John and Kevin are going to do a program preview of the next year, where they will be the program chairman in 2023. And then after we come back from our break in the morning of Thursday, then I've asked Scotty Bolding and Drew Johnson. They live in Fayetteville, Arkansas. Scotty is a maxillofacial surgeon, and Drew is a prosthodontist, to come and share with us what they're doing. Scotty has been doing a lot with both robotic surgery for implants. So we're kind of shifting gears now into more of a prosthetic discussion. And so Scotty's going to share with us what he's been doing with implant placement using both robotic guided implant placement and design of prosthesis, which is what Drew will talk about. And then also some of the new subperiosteal implant that are being used that are really screw-in rather than the typical implant osseointegration. So there's a whole new thing coming out now with subperiosteal implants that Scotty's going to share with us that has been developed a lot in Brazil and just now being used in the United States. It's very fascinating for patients that have very little bone and don't want to go through a sinus augmentation and grafting and things. There's options now for that. And then Drew's going to talk about his whole treatment planning digital workflow related to full mouth cases and implants. And he has done a masterful job of that, and with implants and overdentures and hybrids and things like that. So I'm very excited to share Drew with the Academy. He's a dear friend and an outstanding clinician. And so he's going to do a portion of that presentation as well. And then we'll have a panel with Steve Carstensen, John Cranham, Drew Cobb, Scotty Bolding, and Drew Johnson. And so we've set aside time for that. We feel like the panel discussions are sometimes some of the most informative because it gives us an opportunity as a society to ask questions after hearing our presenters. So that'll take us up to lunch on Thursday, and we're all going to be pretty worn out by then, but there's more to come.
Yeah, that membership lunch is not one that you want to miss, where we get to do the business of the AES.
Yes.
And as always, I encourage those listening to attend because we need you there to run the organization. So
yes.
And right after that, somebody that I know a little bit from knowing you, Whit, but he's going to be our Dawson lecturer this year, which, as many people know, has become the lecture that is highlighted for the year. And it's not a requirement that every year has one, but you have picked one here, a special guy from your neck of the woods, I think.
Yes. So Stephen Masley is a physician who is one of the pioneers in integrative medicine. And so when you have physicians that are looking at the whole person rather than just the chief complaint and writing a prescription, I'm really interested in what they're thinking, and we all are. And so as we're trying to develop a model like that in dentistry, which you might call integrative dental medicine, where we're looking at the whole person, such as the airway issues and gastric reflux and diabetes and oral pathogens and their effect on cardiovascular health. So in medicine, the same thing is happening with integrative physicians. And so Stephen is a real pioneer in this. He's written 5 books that are on cardiovascular health, on healthy fats, on brain health, on diabetes, subjects like this. And he is very highly revered in his field. He happens to also be my personal physician, has turned my health around quite a bit. And we've lectured together, and I highly respect him. We've had him lecture 2 or 3 times now at the American Academy for Oral Systemic Health, AOSH meeting, and always gets rave reviews because he's just brilliant. And so he's going to be giving an 1.5-hour lecture on integrative medicine in 2022. What's the latest that the physicians that are on the cutting edge are looking at now, from genetics to lifestyle influences, environmental influences, how to boost the immune system, how to reduce inflammation. These are the subjects that Steve's going to help us in our personal health, as well as those things that we can share with those that we serve. And so very excited about Stephen coming and sharing his information with the American Equilibration Society, AES. And this Dawson lecture is one that's sponsored every year. We've raised funds so that we can go out and bring in speakers who we may have to pay a little extra for, but we really want to hear. And so that's the purpose of the funds that are in that Dawson Lecture Fund that we have discretionary use of. And then after our break, we're going to bring in a real outstanding dental ceramist and uh, dental laboratory technician, Lee Culp. I'm sure most everyone knows Lee. Lee has been on the cutting edge of ceramics and what we see so commonly used today in things like EMAX and other beautiful aesthetic restorations. But that's not what we're asking Lee to talk about this time. We're asking Lee to address the subject of managing occlusions in the digital world. And he's an expert in digital dentistry, digital laboratory procedures and steps, and working with dentists to produce outstanding outcomes. But I want and have asked him, we have asked him to talk about managing occlusions in this digital world. As we know, there can be some problems now that come up as we get more advanced. We don't want to throw the baby out with the bathwater and forget the basics that we've been learning for so many years from all the pioneers that have been in our society, and the work that we've so diligently tried to produce in healthy joints and healthy muscles and healthy occlusions that are harmonized. So Lee understands that inside out, and he's going to share with us how we can control those things in a digital world, as well as what they're doing in those advanced workshops that he's part of.
Mm-hmm. I'm really looking forward to him as well. I think there's so much potential for updating us on what it means, not only digitally and how we manage that now, which is gaining popularity every day, but also in all these materials, all these new materials that are different than they were even a few years ago, and with their hardness, and how do we polish them and finish them and stain them and glaze them and all that kind of stuff that affects how much space we need to prep and what it's going to look like in the end and what it's going to match. And I think that's a really timely addition there, Whit. So
yeah, that's great. Well, we're really excited. We feel like we're covering all the key topics that are of interest to our society members and guests. I anticipate, because we've been secluded for so long, Jason, that this will be the largest meeting that we've ever had. And I expect there'll be at least 700 or 800 members of our society. And I hope everyone will bring a guest to this meeting so that we can kind of knock it out of the park and really get restarted as we gather together. I was at a meeting in Atlanta just last month of a society that hadn't met in a year. And I'll tell you, it was like a reunion. I mean, people that barely knew each other were hugging each other and so excited to be live. It's just not the same virtually as it is when we're in person. And so I think by this time in February, everyone's going to be just really anxious to get together and to reconnect.
Yeah, I agree. I think that's especially true for an organization like the AES, that when we did a survey of members last year before the shutdown of things, and that was the number one thing people said about why they liked the in-person meeting, even though it's in Chicago in the winter, is because every year it felt like a reunion. It felt like getting back together and seeing old friends and being able to rub shoulders and talk shop with people that are doing it a bit different and like to hear about this complex system that we have and how to manage it in all these different ways. So anyway, huge thanks to you and Sarah for what you've put together. And I agree, and I can't wait to see you in February.
Yeah, me too. Thanks, Jason.